This is Health Broadcasting Service, HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
So, hello and welcome to In Conversation With, a podcast for the Lancet Infectious Diseases. I am Dr. Saleha Hassan, a senior editor for the journal, and I'm joined today by Dr. Aurel Mitja from the Hospital Universitari Germans Trias i Pujol, Barcelona, Spain, to discuss a trial he and colleagues recently published with us. Oral linezolid compared with beneficin penicillin G for treatment of early syphilis in adults, a non-inferiority randomized controlled trial. In addition, we will also be discussing the reasons for the paucity of clinical trials in syphilis and the implications of this trial for syphilis treatment. This paper can be found online at thelancet.com. A very warm welcome to you, Dr. Mitja, and thank you for joining us today. To initiate this conversation, could you please provide some background information about syphilis and its incidence both in Europe and globally?
So syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum, subspecies pallidum. And during the early stages of the infection, the pathogen can spread and cause some serious issues. So we are talking about neurosyphilis that can affect 5 to 10% of patients, and sometimes occurs during the first year after infection, resulting in meningitis, otic or ocular syphilis, or later stage causing neurological and psychiatric symptoms. Also, pregnant women with syphilis are of particular concern because of the risk of transplacental transmission, resulting in 15 to 40% of affected infants. And this is a congenital syphilis, multisystemic disease in the neonate. So regarding the global estimates of syphilis, have seen a consistent upward trend since the year 2000, with recent WHO figures indicating 7 million new infections in 2020. And furthermore, in 2021, EU member states reported more than 25,000 cases. The US reported more than 175,000 cases, and other big countries also are affected, including China, that recorded more than 300,000. So the increasing trend predominantly affects young individuals, particularly men who have sex with men and sex workers, and several factors contribute to the surge, including the expansion of population tests for syphilis and behavior changes. Again, of particular concern are pregnant women, for whom WHO have estimated more than 1 million affected cases annually.
Continuing from that question, could you highlight the main challenges of treating syphilis and what is the standard care of treatment at present?
Sure. So the standard care is penicillin as the first-line treatment across all stages of syphilis, and there's limited evidence available for alternative antibiotics. The choice of penicillin form and duration of treatment depend on the stage. For example, in early syphilis, a single intramuscular dose of 2.4 million units of long-acting benzathine penicillin is recommended, while in neurosyphilis and congenital syphilis, the treatment is intravenous and should be administered every 4 hours for 10 to 14 days. So the challenges come from the lack of existing options for pregnant women who are allergic to penicillin, because doxycycline, the second-line treatment, is contraindicated in pregnancy. Therefore, penicillin allergy testing and desensitization are the only viable choices. Other challenges are the global production and supply issues that have led to an increase in congenital syphilis, and also the difficulties for treating neurosyphilis, which require this lengthy and intensive course of intravenous treatment. Finally, a major obstacle has been the long-standing inability to culture the causative agent T. pallidum. However, the system has recently been established. We are in a historical moment where we can start conducting randomized clinical trials. just think that over the past 40 years, only 5 randomized clinical trials have investigated syphilis and specifically beta-lactams and macrolides in early stages. So no RCTs have investigated other antibiotic families or included patients with neurosyphilis, pregnancy, and congenital syphilis.
Could you also just briefly touch on resistance as one of the challenges?
The resistance has occurred in the past. The bacteria developed resistance to azithromycin, which is currently widespread and making azithromycin ineffective. And other resistance has not been thoroughly examined because so far we are utilizing genotypic systems. This means that we look for point mutations in the bacterial genome, specifically for macrolides and doxycycline. But the phenotypic system is not still in use. This means that direct inoculation of patient clinical samples into the culture has not been achieved.
Thank you. We should move on to your trial now. Could you please tell me why this phase 3 trial was conducted straight after animal studies with the early phase trials that are normally done not having been done so? So why did you choose this path and how was ethical approval obtained for this?
Reason number one is that linezolid is a well-known antibiotic approved for treatment of susceptible gram-positive infections at standard dose of 300 every 12 hours, and more recently, daily